Vitamin C also called ascorbic acid. There is water-soluble vitamin. Ascorbic acid can change into dehydroascorbate. These are the active form of vitamin C. Okay. Now let's know something about history of vitamin C. Okay. Please read this. I have taken it from D.M. Vasudevan. You can see in the year 1500 BC, Epirus Papyrus written this textbook. Please listen. This is not beyond my control, na? Acha. During the voyage of Vasco da Gama, the Cape of God Hope to India, 1498, he lost 2/3 of two members due to scurvy. Okay. So vitamin C also called as anti-scurvy vitamin. Anti-scurvy vitamin. Later you can see the Britishers have come to know that vitamin C prevents scurvy. That is why they started rationing with vitamin C with their diet when they go into sea. By this way, they conquered all over the world. Okay, vitamin C actually indirectly helped Britishers to come in India and rule us. By this way. Okay, this is my history. In 1928, Gilbert and Associate showed that the anti-scorbutic factor present in lemon juice, which is a reducing substance. In 1930, Albert Suzanne Gogori, he got a Nobel Prize. He named it as hexuronic acid. Later, in 1933, Howard, he established the molecular structure of vitamin C and renamed it as a ascorbic acid. These are the 50 factor. You don't have to remember everything. Now let's say important topic, vitamin C. It is water soluble, as I told earlier, and it is easily destroyed by heating, alkali, and when you store, it will destroy. So every time you have to take fresh foods. There you can have vitamin C. Structurally, it is similar to monosaccharide. Look at this, it is like a glucose or fructose like this. 1, 2, 3, 4, 5, 6. 6 carbon is there. বন্ধ করো না, ডিস্টার্ব হচ্ছে তো, বন্ধ করবে না। 1, 2, 3, 4, 5, 6, just like hexose sugar. Okay, this is ascorbic acid. It can convert easily into dehydroascorbate acid. These are the interchangeable, and these two are biologically active form. Later, it can further convert into diketoylglucuronic acid. From there, it convert into oxalic acid. Some of this amount and oxalic acid, they escape through urine. Okay. We may ask you in the Bible exam, what is the excretory form of vitamin C? You have to answer. Oxalic acid mainly, and some of them is diketoylglucuronic acid. Glunic acid, sorry. Understand? The excretory form of vitamin C. Oxalic acid and diketoglunic acid. ठीक है, ये the excretory form of vitamin C. You have to remember this. Okay. Now vitamin C has NADL group in their structure, and it has reducing property. So if you take vitamin C and later you go and test urine for a vanity test, it may give you a false positive result. This is a strong reducing substance. Okay? You may ask in the Bible exam. Remember this. Remember, only L-ascorbic acid is active form, but D form is not active. Okay? Next. Most animals can synthesize vitamin C in their body, but human being cannot synthesize. Why? Because of the deficiency of an enzyme called guanylactone oxidase. This enzyme is deficient in human being and upper primates. This is a important question in your Bible exam, in your MCQ exam. Remember? Only remember this. Guanylactone acid, guanylactone oxidase. Guanylactone oxidase. This enzyme is deficient in human being because the gene responsible for making this enzyme is deficient in human being. Okay. But some animals can synthesize vitamin C. So we have to supply vitamin C every day with our diet, because even we cannot store it inside our body. This is a water-soluble vitamin, can easily escape through urine. The pathway which make this vitamin C is called glucuronic acid pathway. This is described in your body in textbook. Look at this. Here gluconate combined into L-guanylactone. From L-guanylactone combined into 2-keto-L-guanylactone. This enzyme is responsible guanylactone oxidase. For 2-keto-L-guanylactone combined to ascorbic acid in lower animals. This enzyme is deficient in human being. Okay? Okay. Next. Metabolism of ascorbic acid. This is very important. Vitamin C, it is a water soluble, so it can easily absorb through GI tract and excrete in urine. Since vitamin C is a strong reducing agent, the Benedict test will be positive in the urine sample after vitamin C administration. Oxidation of vitamin C, it gives rise to alkali acid into dehydroascorbate acid, which is further oxidized into diketo-L-glucuronic acid and oxalic acid. Oxalic acid. Most of the oxalate in urine are derived from vitamin C, ascorbic acid, and rest are from glycine metabolism. Okay, so you may ask you may get an MCQ exam. Please tell me, write down what is the substances which give rise to oxalic acid. Either it may be vitamin C or maybe glycine metabolism, or both is correct. Okay. Next. The plasma level of vitamin C. Sorry, any question? Okay. Plasma level of vitamin C 0.7 to 1.2 milligram per deciliter. Where it can have high concentration found in WBC, up to 25 milligram per cc of white blood cell. Okay. Low level found in the woman taking oral contraceptive pill and the people are chronic alcoholic. We can have low level of vitamin C in your plasma. Okay. This is another question. Why you can have low level of vitamin C? Woman taking oral contraceptive pill and the patient, the person who is taking alcohol on regular basis. They can have low level of vitamin C. Okay. Vitamin C can accumulate in the wound and it helps in wound healing. So, in our regular practice, we prescribe vitamin C regular basis with patient with multi-trauma or trauma or infection. Okay. Next, biochemical function. A long list is there. You don't have to remember everything, but you have to remember some important things. Reversible oxidation reaction, vitamin C can remain either as ascorbic acid or as dehydroascorbate acid, as I told earlier. This is very, very important. You have to learn this. Everyone should learn this. Hydroxylation of proline and lysine. This is very, very important. When we ask some question in exam like Scurvy, everyone has to write this. Hydroxylation of proline and lysine. Okay. Vitamin C helps proline and lysine to combine into hydroxyproline and hydroxylysine. And hydroxyproline and hydroxylysine is very important for cross-linking of collagen fiber, strengthening of collagen fiber. Okay, understand? This crossing is very important for supporting tissue such as osteoid, collagen and intercellular cement substance of capillaries. Okay. Here it is. Say this is a protein, say collagen protein. Here we have proline residue. Proline residue. Okay. Vitamin C, it helps in proline hydroxylase to convert proline into hydroxyproline. Everyone have to remember this fact. We may ask in the exam. If you do not write this fact, we may get you 0 marks. Remember. You don't have to write lot of things in your exam paper. Just write the important things. If anyone writes just 1 or 2 words, important word, we give you full marks. Understand? Okay. Next function is tryptophan metabolism. Tryptophan is what? One essential amino acid. And then tell me how many of essential amino acids is there? 9. Can you tell me one or two names? Name of essential amino acids. Total 9. Leucine, isoleucine, lysine, valine, methionine, tryptophan, phenylalanine, histidine. How many is there? Total 9. You have to remember. Okay. So vitamin C help in tryptophan metabolism. For necessary hydroxylation of tryptophan to 5-hydroxytryptophan, which is required for formation of serotonin. This is a hormone. In help, lot of various functions there, like sleep, pleasure, nerve conduction, serotonin. Okay, next is tyrosine metabolism. Vitamin C help in oxidation of para-hydroxy phenyl pyruvate to homogeneric acid. Next is iron metabolism. This is very, very important. Everyone have to remember this. Vitamin C, role of vitamin C in iron absorption. Iron we consume in ferric form, it converted into ferrous form in order to absorb through GIT. If you don't have ferrous form iron, we cannot absorb it. Vitamin C help conversion of ferric state to ferrous state of iron. Okay? So if patient is suffering from vitamin C deficiency, they eventually goes up with iron deficiency also. I have seen a lot of patients. So without ferrous form conversion, iron cannot be absorbed through GI tract. Okay? Next is hemoglobin metabolism. Vitamin C is useful for reconversion of methioglobin to hemoglobin. Next, folic acid metabolism. This is another important water-soluble vitamin, B vitamin, folic acid. Vitamin C helps enzyme folate reductase to reduce folic acid to tetrahydrofolic acid. Thus, he will help the maturation of RBC. Okay. Next is steroid synthesis. Large quantity of vitamin C is reserved in adrenal cortex. When ACT stimulates adrenal cortex, the vitamin C level goes down. By this way, we can assume that vitamin C help in steroid hormone synthesis. Understand? The ascorbic acid deplete by ACTase hormone stimulation. So the vitamin has some role in adrenal steroidogenesis. Vitamin C also help in the synthesis of bile acid from cholesterol. Next is phagocytic activity. High level of vitamin C found in WBC, white blood cell. It helps in phagocytosis. Ascorbic acid stimulate phagocytic action of leukocyte and help in the formation of antibodies. Okay. So see how many functions the vitamin C. Iron absorption, our immunity, phagocytic activity, okay, tryptophan metabolism, tyrosine metabolism, folic acid metabolism, iron absorption, steroid hormone synthesis function. Lot of functions in the vitamin C. So how many of you don't like to take lemon juice? How many of you don't like? You have to take vitamin C. This is very important for your health as well. Understand? Today onward, you start taking lemon juice also with your meal. Understand? This is very, very important for your health. Understand? Next. Any question till now? Any question? No question? Okay. Let's move forward. Next is antioxidant property. You see, list is very long. Vitamin C also acts as an antioxidant vitamin along with vitamin A, vitamin E, tocopherol. Okay. Vitamin E present in cell membrane In your vitamin E lecture classes, I told vitamin E present in cell membrane and it works as a scavenging of free radicals and it itself converts into radical, and then vitamin C goes and escape this vitamin E, and then vitamin C along with the free radical is escaped out through our body from kidney. Okay. Vitamin C antioxidant property, as an antioxidant it may prevent cancer formation. It is seen that aniline dye are known to induce bladder cancer in factory workers. Daily intake of vitamin C reduces this risk of cancer. The role of ascorbic acid as an antioxidant is well proved, but recent work highlights the importance in neuromodulatory function in brain cells and immune protective effect in various other tissues, diseases. So vitamin C, the person work in dye factory, aniline dye, they have high chance of bladder cancer. If you supplement them vitamin C, eventually it prevent their cancer formation. Someone of you after passing MBBS may work in a factory or an industry. There you have to prescribe this vitamin C, the workers. So this effect is very important. Okay, everything related with our clinical practice. Your knowledge is very important. Your knowledge can save people's life. Okay, so learn and enjoy and make the society to become healthy. Okay, we doctor can save lot of people's life through our knowledge. So you have to enrich yourself with knowledge. Each and every day you have to learn new thing. Simple vitamin C, lot of important thing. And these will help you in future practice also. Next is cataract prevention. What is cataract? Any question? Cataract? Any idea? Cataract? White is discoloration or haziness of eyelids. Good. Vitamin C accumulates in the eyelids also and prevents cataract formation. Okay. Next, very important, deficiency manifestation of vitamin C. First one is scurvy. Everyone should learn this fact. Everyone must learn this. Scurvy. What is scurvy? When there is prolonged and gross deficiency of vitamin C, eventually patient develops scurvy. Especially in infant who are in weaning period. That is, they are going from mother's breast milk to normal diet. That time, if you do not supplement vitamin C, eventually they develop scurvy. Scurvy is weakening of blood vessel because of the defective collagen tissue formation. As a result, there may be some bleeding spots under the skin. That is called petechial spot. In prolonged period, you may end up with ecchymosis or even bruising, big hematoma because of the weak blood vessel. Okay, in gum, there may be gum bleeding during teeth brushing or even touching the gum. Patient they experience some blood coming out through gum. Weakening of teeth from teeth sockets. Okay, scurvy, a painful condition. I have seen some patients, some children especially, they only take chicken. They don't like to eat any vegetables. They experience some gum bleeding. This is a person of scurvy. I have seen some patients, some children, 5 or 6 years old, they never take any vegetable diet. They only take fish, meat, egg, and sometimes they like to eat Maggi or something with this kind of food. I've seen. Understand? Scurvy. The first one is scurvy. Gross vitamin C deficiency results in scurvy in infant between 6 to 12 months of age, period in which weaning from breast milk. The diet should be supplemented with vitamin C sources. Otherwise, deficiency vitamin is seen, which is named infantile scurvy or Barlow disease. Okay. Next is hemorrhagic tendency, vitamin C deficiency, collagen abnormal. As I told earlier, vitamin C help in cross-linking of collagen fiber by the hydroxylation of proline and lysine. Okay. So, when there is defective collagen tissue, there is weakening of blood vessel. It causes hemorrhage. Like capillary is fragile, leading to the tendency to bleed even under minor pressure. Subcutaneous hemorrhage may be seen, may be manifested as petechiae in mild deficiency or ecchymosis or even hematoma in severe condition. If a blood pressure cuff, sphygmomanometer cuff is placed in the forearm and pressure is kept for 5 minutes, petechiae may be seen under skin. This is a useful clinical test. So you can diagnose it in OPD. Just simply put the blood pressure cuff here and make some pressure, say above the diastolic pressure, and keep it for 5 minutes. Eventually patient develops some bleeding spots under the skin. Okay. Hematoma is a collection of big amount of blood. Hematoma. C. Gum bleeding, loosening of tooth, the swelling of gum. When it touches, it will bleed. This is petechial rash. This is epistaxis, nose bleeding. In severe deficiency, patient may develop big amount of blood loss, severe hemorrhage, under conjunctiva, retina, internal bleeding may be seen in epistaxis. This is epistaxis. This is severe deficiency. Hematuria, there is blood losing through urine, and melena, there is black color stool, blood losing through stool, melena. You will read in next pathology lectures classes, in your second and professional MBBS classes. Okay. The oral cavity is in severe cases, scurvy, gum become painful. This is painful gum, swollen, and spongy gum. The pulp is separated, hair pulp is separated from the dentine, and finally tooth are lost. Wound healing may be delayed due to vitamin C deficiency. Next, you don't have to write anything. Everything written in your textbook. Don't have to write anything. No, just listen here. Next is bones. In the bone, deficiency results in failure to osteoblasts to form intercellular substances, osteoid. Without the normal ground substance, the deposition of bone is arrested. The resulting scorbutive bone is weak and fractures easily. Bone may break down easily. There may be hemorrhage into the joint cavity. This is hemorrhagic joint. Painful swelling joint. This is obviously painful swelling, and joint may prevent locomotion of the patient. The swelled joint, he cannot move their foot. Here this is a nail bed. Here see some red spots under the nail. Nail are easily broke down. This is our sign of scurvy. Bad nail. So your nail health, vitamin C is so important. This is ecchymosis. Black is big area of black coloration. And this one is petechiae. This is petechiae. Petechiae. This is ecchymosis. Ecchymosis. Okay. Nails are spoon-shaped, are characterized by its concave shape, and nails are often thin and brittle. Red spots or vertical lines. Here red spots, the vertical line you can see. A nail bed known as splinter hemorrhage. may also appear during vitamin C deficiency. This is due to weakening of blood vessel that ruptures easily under the nail bed. Okay. Next, anemia. As I told earlier, vitamin C helps conversion of ferric to ferrous form of iron. So, if there is vitamin C deficiency, iron absorption decreases, and iron is very important for prevent anemia to make RBC. So, there is vitamin C deficiency. Indirectly, there is iron deficiency. And iron deficiency causes iron deficient anemia. Reason for anemia: loss of blood to hemorrhage, decreased iron absorption, decreased tetrahydrofolic acid. There is vitamin C deficiency patient also, they may suffer from folic acid deficiency. They do not like to take any green vegetables diet. So there is folic acid deficiency. Okay, this is another reason. And accumulation of methemoglobin. Vitamin C help conversion of methemoglobin to hemoglobin. Okay. Next is dietary source. Amla or Indian gooseberry. This is the highest source of vitamin C. Everyone should remember this. You may ask you in the MCQ. 100 milligram per 100 gram of amla or Indian gooseberry. Next is guava. 300 milligram per 100 gram of guava. All kind of citrus fruit like lemon, orange, Musambi. Have you heard the name Musambi? Musambi. Santra. Came from Bihar UP. Bihar UP. Student, please raise your hand. Student from Bihar UP. Amla. Got the name Amla? Okay. Santra. Very good. I stayed in Patna for 2 years. There I heard the name as Santra. Okay. But remember, milk is poor source of vitamin C. Milk. Next is recommended dietary allowances, RDA. 60 to 75 milligram per day. This is a normal population. 60 to 75 milligram per day vitamin C have to give through your diet. But during pregnancy, lactation, and in old age people, the requirement increases up to 100 milligram per day. Okay. Next, therapeutic use of vitamin C. Vitamin C tablet form we can find commercially available. 500 milligram per tablet, like Lim C. Or chewable tablets there, commercially available. Brand name Lim C. We often prescribe the patient during COVID period. We prescribe vitamin C supplement along with other medicines. Patients suffering from COVID positive, COVID-19 positive patients. Okay. So you can give patients suffering from chronic infection like tuberculosis, leprosy, or any form of infection. You can prescribe vitamin C. Patients suffering from trauma, injury, cut injury, or burn patient, you can prescribe vitamin C. It helps in wound healing. Understand? Next, toxicity. As this is a water-soluble vitamin, so there is no toxicity. Literally, there is no toxicity. If you take peak amount of vitamin C, the extra amount will easily excrete out to the kidney. But if you take vitamin C in a high dosage, like more than 2 grams per day, for prolonged period, it may eventually lead to iron toxicity. Because vitamin C helps in iron absorption. It converts ferric to ferrous form. So if you take vitamin C for prolonged period, a high dose, eventually iron will accumulate in your body and causes iron toxicity. This is called hemochromatosis. Hemochromatosis. Iron toxicity, one form of iron toxicity. Iron can accumulate in heart, causes heart failure, in pancreas, causes pancreatic failure like diabetes, in kidney, causes kidney injury, chronic kidney disease. In joint, it can accumulate joint, extra iron, causes joint damage, arthritis. Okay? This kind of toxicity can have in patient of iron toxicity. Apart from vitamin C, can you tell me some other conditions why patient develop iron toxicity? Anyone? Patient with repeated blood transfusion, like thalassemia, they develop iron toxicity. Okay? Patient with thalassemia, have you heard the name thalassemia? Thalassemia? You read in pathology classes. Thalassemia. Okay? There is premature destruction of RBC because of defect in chain. Two chain is the alpha chain, beta chain in hemoglobin. There may be deficiency of beta chain, beta thalassemia. So the spleen start destroying deformed RBC. Okay? Patient develop repeated anemia and have to go for repeated blood transfusion. Eventually they develop iron toxicity. Okay? Next. This kind of question may ask you in the exam. Should be familiar with this. Anyone, please stand up and read this loudly. Anyone, please come here. Anyone volunteer? Anyone, please come. Please come. Complaining of petechial rash
all over body for last 15 days and bleeding. During the rushing for last 6 months and occasionally was bleeding for last 3 months and he had frequent cough and cold. On further examination reveals deformed feet, swollen gum which bleed easily or touch, swelling of the joint, brittle nails, tender bone, and the child is anemic.
Please sit. What is your? Write about the biochemical causes of this fish problem. How can you treat this child? Please read now.
How can you treat this child and what would be the dietary advice of the child?
Mother, please, thank you. Understand? So you have to correlate with this, with your theory knowledge, with your practical aspects. This kind of question you have experienced now. This kind of question is come in your exam. So, what is the diagnosis? Diagnosis is Scurvy. Okay? Write about the biochemical cause of this problem. Scurvy is a deficiency of vitamin C. Vitamin C will help in hydroxylation of proline and lysine. Okay? In collagen protein. And hydroxylation causes strengthening of collagen fiber. When there is vitamin C deficiency, this hydroxylation eventually cross-linking of collagen tissue defective. So there is defective collagen tissue which causes weakening of wall of blood vessel capillaries. This capillary can breathe easily under the skin, causes petechial rash. In severe deficiency, it causes massive hemorrhage, causes hematoma. Joint is swelling because of big amount of blood collected in the joint. Because joint is movable, na? Always baby is walking, running, jumping. So there is some trauma on the joint, causes bleeding on the joint space, causes swelling of joint. Okay, there is weakening of blood vessel under the gum also, swelling of gum. When you touch, it causes bleeding. Okay, the teeth is deformed because of the weakening of their denture, loss of teeth. Okay, so these are the problem. So rest, we explained. Delayed wound healing because vitamin C help in wound healing. Okay, bleeding gum, I explained. Occasional nose bleeding, there is epistaxis because of trauma. Sometimes baby has habit to khujlana. Sometimes they itch their nose, causes some trauma because of weakening of weak blood vessel, causes bleeding from nose. There is epistaxis. Frequent episode of cough and cold because child is less immunity power. I told vitamin C accumulate in the WBC, in help in phagocytosis. So phagocytic activity goes down because of vitamin C deficiency. Swelling of the beetle nail because of scurvy. You have seen beetle nail. Here it is beetle nail. Nail can break easily. This swelling joint. Ecchymosis. This is epistaxis. This is petechiae. This is swelling of gum. This is bleeding from gum during brushing. Okay. So how can you treat this child? You have to give vitamin C supplement tablet. Dose is 500 mg per day. Limb-C chewable tablet is there, commercially available. You give them 1 tab daily. There is Limb-C 500. Have to chew it daily 1 tablet. Okay. So what will be your dietary advice to the mother? Have to give citrus fruit, green leafy vegetables. That is simple. So if you know, the answer is very easy. If you doesn't know, answer is very difficult. Okay? Any question? No question? Thank you.